Marion also would like her cheeks done. And she's full medially. She just is lacking a little bit out to the sides and some in the medial part of the cheek. So I make a line from the corner of the mouth to the tail of the brow, and then to the helical root superiorly to the corner of the mouth, and then I use that area in between and some just a little anterior when I want to do a little anterior projection, but mostly lateral projection on her, because she has beautiful cheeks already, but she's just like a little enhancement of that area. And you can do this with a tongue depressor if you like for a straight line, but a ruler if you like. But freehand works also. And again, she's already been cleaned, so you don't want to put any filler above the level of the lateral brow. Excuse me, the lateral canthus. Excuse me. Good. Okay, so for under her eyes I use Restylane, which I really like. And for her cheeks, we're going to use Restylane Lift, which is sort of replace Perlane. It's a little larger particle hyaluronic acid. There's a lot of things you can use in the cheeks. There's Radiesse, there's Juvederm Voluma, but she's had the Perlane in the past and absolutely loves it, and it lasts a long time on her. So we're going to use the replacement, which is Restylane Lift. So there's a lot of ways to inject the cheek. You can use cannulas, and you can use needles. You can use longer needles. I've found that if I make a couple of entrances with the needle and put a certain amount in that particular area, I'm able to massage this into exactly the shape and form that I want it, with very little bruising, very little discomfort, and the projection and result that we both like. And again, we've done this before, so I kind of know what she's interested in having. So I start out towards the front portion of the line and where I've outlined, and I just slowly inject. Again, it's slowly. She's already iced her face, so I know that she's pretty numb in that area. And there's a little lidocaine in this. And then I'll just inject slowly into this area, and through that I can get a decent amount of anterior projection of that cheek just through this area right here. Then I'll just back it up a little bit, and instead of injecting anteriorly, I'll try to fill this up to taper it into a lateral cheek sweep. And again, very slowly. And then you feel where that product is and where you ultimately want it. And it's massageable very nicely for the first 24 hours, really. Then I'll keep going back a little bit. I want to create sort of a cheekbone and a little submalar hollow at the same time, because it's attractive. And again, we're going to just massage the product in and smooth it out. And you got to be careful, because the skin gets a little thinner. The bone's right there at the lateral side of the injection site. So you want to go very slowly. You'll see sort of a poofiness underneath the skin, and you're like, well, that doesn't look right. But as soon as I start massaging it, you'll see how it falls right into place. Did you feel anything when I was injecting you at all?
Just a little bit of pressure.
Good. But no sharp pains or anything
No.
like that?
No.
Good. Look at me, please. Good. And you can see the difference in this projection of this side of the face versus this side, which has been injected now. You want to be careful not to get it too much out here, or else it'll look a little odd, where it'll be lumpy. Excellent. All right, great. So you can put the ice on the other side now. And that's just 1 cc of product right there. So we're going to do the other side. So we just wiped off the marks on her. Her cheeks look beautiful. I think that looks terrific.